From the News Channel 8 studios, let's talk live with your hosts, Natasha Barrett and Melanie Hastings.
October is Global ADHD Awareness Month. So what should you know about this behavioral disorder? Ann Dolin is the president of Educational Connections, and she's here today with some important information for all of us. Hi, Ann.
Hi, Melanie.
Great
How
to
are
see you.
You too.
So there's this conference coming up in Arlington this month, and you're going to be speaking at it. It has to do with ADHD.
Yes.
Tell us more about that.
Well, it's actually the first week in November. It's CHAD. CHAD stands for Children and Adults with ADHD. It's their 25th annual national conference right in Crystal City at the Hyatt. So it's a great event. People from all around the world come and discuss the latest research, what's going on in the field of ADHD. So we're really lucky to have it here in DC.
What will you be speaking on specifically?
I am talking about when academics and ADHD collide. That's a huge thing for many of our students. They really struggle staying focused in school.
I'm sure you see that quite often.
Yeah.
Why are we talking about ADHD so much these days?
Well, you know, diagnosis is on the rise, and it used to be that about 5% of kids were diagnosed with ADHD, but recent figures have found that it's really about 11%. So some people are concerned that it's overdiagnosed. So what we do know is it's more diagnosed in affluent areas like ours here in the suburbs of DC, but it's far less likely to be diagnosed in rural areas and inner city populations.
And for those who are unfamiliar, it's attention deficit hyperactivity disorder.
Yes.
And typically this is when kids are a little too rambunctious, that they can't focus on their schoolwork or on anything else.
True, and actually it's in two forms. You know, a lot of times people think ADHD is just about hyperactivity, the kid who's really fidgety, can't sit still. But that's actually not as common as the inattentive type. Inattentive type is the student who can't stay focused, has trouble finishing tasks, and is often kind of like the daydreamer. And those kids definitely are more common in the classroom, but they often are far less likely to be diagnosed because they're not behavioral problems.
So what are we looking for in children? If we're the parent, how do we know if our child is just a little bit active, more active than maybe the next kid, or if there's really an issue or a problem that needs to be addressed?
You know, that's the great question, because sometimes parents say, well, isn't every kid a little bit ADHD? And it's true. At any time in our lives when we've got a lot going on, we're going to be a little flighty. But if we see that it's really impacting quality of life, and it's not just in school, but maybe it's home too. For adults, it's not just at home, but it's also at work. When we see that it's impacting major life functions, and it tends to be more chronic. So it's not just, you know, you forgot a few things at school, but it's been going on for a while. That's more of a sign that it might be outside of the developmental norms. And that's when you want to see your pediatrician.
That's just it. Who do you go to first?
Really the pediatrician. You know, that's typically the first person you're going to visit. A pediatrician can make a diagnosis. Psychiatrists can too. Sometimes parents will want to have more in-depth testing, and they might go to a psychologist. But in general, the first stop is the pediatrician.
And how do they diagnose this?
Well, what they're going to do is give the parent checklists to fill out for them to rate their child's behaviors. They'll also have the other parent or a significant other fill out a checklist, and the teacher too. So the pediatrician will take that data along with a full history of the child, and that's an interview with the child and the parents, and take all that information and make a diagnosis. So as you can see, it's a little bit subjective. And so now we're looking at new ways to diagnose it that are more data-driven. The FDA just approved a new type of EEG mechanism that just takes 20 minutes. Kids are connected to electrodes. The EEG monitors brain waves and can give the clinician feedback as to whether ADHD is present or not.
So, you know, there's been a lot in the news about how perhaps ADHD is being overdiagnosed. What can you tell us about that?
I would say I've seen it both ways, to be honest. I've seen parents really in denial and won't even go to see anybody about it when it's clearly impacting their child. I've also seen kids with very mild symptoms, and they're kind of on the cusp, and they've gotten the diagnosis. I think sometimes, and this again is just opinion from an educator, that sometimes professionals see that the child is kind of borderline, but they'll make that diagnosis so that the student gets some type of help. It just may not be that the child needs medication, but perhaps some parental behavioral support, some different ways of doing things at home, accommodations at school. Those things can sometimes do the trick.
All right, tell us about some of the ways that it is treated.
Sure.
You mentioned that there are some drugs available, and you know, the first one comes to my mind, Ritalin, right?
Sure, yeah.
What can you tell us about the different medications that are available to treat ADHD?
Sure. Well, usually the first line of treatment is a stimulant medication, and actually these medications have been studied more than any other type of medication for a childhood disorder by National Institutes of Mental Health. So they're safe. But we do know that some kids can have side effects. It can be that they lose appetite or they have more difficulty sleeping. But stimulants such as you mentioned Ritalin, Concerta, Adderall, Vyvanse, those are typically prescribed to treat ADHD.
All right, and then should parents be worried about the child taking a drug? I mean, you say they've been studied and
Yes.
studied and studied. I mean, are there the negative effects, I mean, for giving your child a drug?
Every parent, you know, it's such a hard decision. It's a personal decision whether to medicate your child or not. So you kind of have to step back and say, what's in the best interest of my child? Try to take your personal feelings out of it. Consult with your pediatrician or another professional, and then make an educated decision.
Lots to consider there. Education expert Ann Dolin, thanks so much for coming in
Thanks,
and talking
Melanie.
to us today.